Hi, everyone. Welcome to Berry Chat with Dr. Sayat, where we have honest conversations about weight loss surgery, healing, and hope. I'm Dr. Alvand Sayat, a bariatric and foregut surgeon, and also a bariatric patient myself. This podcast is about understanding the science, the stories, and the people behind metabolic surgery. So settle in. Let's chat. Hello, good morning, everyone. This is Alvin Sat, your host of Berry Chat with Dr. Sat. I do apologize for being away from the podcast for a while. There's been a lot of life updates and hectic things that have happened, but I'm excited to be able to come back and start doing this hopefully weekly, releasing weekly episodes. So a few updates on my end. Fellowship is over. I have graduated from a bariatric and foregut fellowship at a Menorah Medical Center in Overland Park, Kansas, which is a suburb of Kansas City, Missouri. Enjoyed my time there. Very appreciative of my time there with being trained by Dr. Nicole Fearing and Dr. John Tan, who, as the patients of our practice know, will be transitioning over to a private practice hopefully soon. But my co-fellow Sam and I have already graduated and are appreciative of their mentorship and their extensive training with us. Definitely a great training program. I mean, I couldn't have asked for a better place to be trained at in terms of the comprehensive breadth of both bariatric surgery and foregut surgery, as well as learning how to run a practice, how to run a reflux center and do all the interventions for reflux, the diagnostic interventions, including the diagnostic and therapeutic endoscopy that we have done as well. But, it's definitely been a great year, a great ride. Happy to have graduated, happy to have trained with them. Sad to be leaving the patients a little bit early and sad to be leaving Kansas City early. However, we've definitely enjoyed our time here. Other updates are, I had to press pause on the podcast just because of the graduation and fellowship got so busy. But my plan is to get this back up online, hopefully to be able to produce weekly episodes for you guys. Before everything got so busy, I do have at least 2 or 3 episodes that have been on the back burner to be published. And I've reached out to the patients asking, what would you guys want to hear in newer episodes? And I've definitely listened to your feedback. I appreciate you all taking the time to give me feedback on things that you want to hear. And I've already lined up some new guests because of that feedback. So definitely appreciate it. And please keep the suggestions coming. Either reach out to me on my social media, or if you want to email me directly at drajsad@gmail.com. I would love to hear from you. I'm happy to answer any questions you may have, or if you just want to chat. Let's see what else has been going on. Currently on the job hunt. So trying to find a job in bariatric foregut surgery. Bariatric surgery a little bit difficult nowadays because of the era of GLP-1s, almost like a hiring freeze a little bit, but it's not impossible. And just, that's why I did general surgery, bariatric and foregut, so that you can pivot to anything depending on the climate that's going on right now. So I'll definitely update you guys and let you know where I end up. And if you want to become a patient, be happy to see you there. So let's see what else. Recently went to my first ASMBS conference in San Antonio, Texas. That stands for the American Society of Metabolic and Bariatric Surgery. I just think of it as like one big giant conference think tank of all the experts in metabolic bariatric surgery around the country getting together, presenting, their newest research, presenting the most updated guidelines, if there are some, and just having the general discussion of bariatric surgery and where we are right now and where we hope to go in the future. It was my first one, so I was very excited to be able to go. I had a video presentation to present. I presented on our experience converting patients with sleeve gastrectomies to an OAGB, also known as a mini gastric bypass, or what it stands for is a 1 anastomosis gastric bypass. We've been seeing some pretty good results with that. I had a very fruitful discussion after the presentation. Really great questions, and I was just happy to be there to be able to showcase our work. But it was a good time. San Antonio is my second hometown. It's where I did college and high school, so it was good to be back. Get some good Tex-Mex food for sure. I definitely miss the breakfast tacos. I haven't had those in such a long time. Breakfast bagels in New Jersey were amazing and great, but there's something about a breakfast taco that's just wonderful. The vibe there was good. It was great. Definitely learned a lot. I got to meet some people that I've read their papers and I watched their videos, so I was able to meet those people and have good discussions with them. And
really the vibe there was that, it was kind of a mixed bag. I'd say some people are, worried about the future of bariatric surgery in this era of GLP-1s, while others I think are doing a really good job pivoting of, what bariatric surgery, metabolic surgery care is going to look like in the future. And the best example that I can think of, and something that I think makes sense to a lot of patients and a lot of people is oncology. Like when you look at oncology, there's lots of different types of cancers, and there's lots of different providers that are helping to treat your cancer. And it's a multidisciplinary kind of setting because, there's lots of tools in the toolkit to help treat cancer. And it all is different depending on the type of cancer you have. And it's a very collaborative environment. I remember in residency that, one of the things that we would do is create presentations for the multidisciplinary tumor boards where we're sitting there in a big conference room with surgical oncologists, medical oncologists, and radiation oncologists, and every other aspect of oncology care, where it's the cardiologists, nephrologists, the physical therapists, the case managers, et cetera, et cetera. Everyone is there figuring out what's the best way to take care of this patient and what's the best treatment plan for it. Because it really is not 100%, everything gets treated exactly this way. There is nuances, for every single patient as well. So you have to keep that in mind. And I think bariatric surgery is going to be the same thing. Just like that there's a medical oncologist prescribing the chemo, there's a bariatrician that's prescribing your GLP-1 and all the other medications for your medical weight loss. And they're board certified physicians in obesity medicine that help figure that out. Of course, there's the surgeons, just like there's a surgical oncologist that their job is to either put in your Mediport or to cut out the cancer, reconstruct you depending on what you need on your specific cancer. That's their job to cut that out. And sometimes, depending on the cancer that you have, that's the only thing that you need, and that's the cure. Versus you need that plus chemotherapy, or you need that plus chemotherapy plus radiation, where the radiation oncologist, after everything is done, or even in the beginning, will prescribe a treatment plan for you to get radiation to help either shrink your tumor or kill anything remaining. Just like with chemotherapy, either it happens in the beginning or happens towards the end after surgery. Again, to either shrink your tumor, cure the tumor, or to help kill any residual cells that are left behind to make sure that you don't have a recurrence. Because oncology is this disease that needs to be treated in a multifaceted fashion sometimes. And that's the best way I can think of where bariatric surgery and metabolic surgery is moving in the future, because as we know, obesity is a chronic metabolic disease. It's not just if it was as easy as calories in and calories out, then we wouldn't need bariatric surgery, or GLP-1s wouldn't be so popular, et cetera. There is a metabolic hormonal component of why some people can do everything right and still not see any weight loss, and there's people who can eat a box of donuts every day and still not gain any weight. There's definitely a metabolic component driving all that. That being said, is our sedentary lifestyle in the United States and the quality of our food contributing to that? Yeah, absolutely. Like there's no doubt about it that, if we're not eating wholesome foods, we're eating more processed foods, and we're not getting up and moving around, that's definitely going to impact it. But if you think about the way I think about it is that if someone has the gene to be very tall, but they don't live in an environment where they're getting enough nutrition, they're never going to be tall. They just won't be, because even though they have the predilection for it, they're not in the environment to help set that up. It's the same thing with metabolic disease, obesity on the flip side. If you are in a high nutrient, high calorie environment and sedentary, and you unfortunately happen to have a genetic defect, hormonal defect, et cetera, what have you, that predisposes you to metabolic dysfunction, then you're going to be going down that path of metabolic dysfunction and be more prone to obesity rather than people that aren't prone that way. Just like, actually, I don't know why I didn't use this example, alcoholism. Addiction runs in, as a genetic component, and runs in families. But if you never drink alcohol in your life, then you won't become an alcoholic. But if you do pick that up, then yeah, you're more prone to it because of your family history. It's same thing with obesity, I think. But the problem is that just not only in the United States, but I think it's worldwide, is that we see obesity. And again, that's different, culture to culture. Standards of beauty are different, et cetera. But generally, people say that, oh, it's because of, just because of willpower and just because you've been eating too much and et cetera. And you just need to buck up and just, get after it, which, yeah, you do need to take charge of your health and get after it. But that's not the only solution. It's not as simple as that. Otherwise, this obesity wouldn't be a huge problem in this country. By 2030, over 51% of Americans are predicted to be morbidly obese. And it's a much tougher cookie to crack. So you know, where we had sat in lots of different conferences that I thought was great, that basically set up like what a system of bariatric metabolic surgery would look like and how the clinics of the future would look like. Which is that it's a multifaceted medical, endoscopic, and surgical weight loss, and how all of these services are collaborative and tying into one another and not competing and staying in separate silos, which I think that that's what it should have been, from the beginning. I don't know why it took us this long to change, but, necessity is the mother of invention and chaos is the mother of innovation. So I think that this chaos of what's going on with the GLP-1 in our realm of bariatric surgery is temporary, and we just have to adapt. And it's actually going to lead to a much better comprehensive care for the bariatric patient in the future. I keep saying in the future, but really, I mean, it's right now. People are doing it right now. We were doing it in my fellowship. We just need to have a streamlined process for that, which it was nice to sit in some conference, some talks and see how different practices around the United States have already streamlined that process, and something that I will definitely be doing in my future practice wherever I end up. But, it was a great conference. Definitely reiterated some things that we already knew about, and something that I'll, bring up again on this episode is that, bariatric surgery is the most powerful tool in the toolkit, and it has the most longest and durable results of everything else in the toolkit. It doesn't, it's not a magic pill. It's not that's it, you're cured. Because again, this is a chronic disease, and chronic diseases will relapse and have recurrences and need to be managed. There's not a cure for it per se. It's just the most powerful tool that we have in the toolbox. I think of it as that you can build a house with a hammer, but you can also build a house with a power drill and power tools. And bariatric surgery is our most powerful power tool in the toolkit, for sure. And then those health effects are not just coming from just losing weight. Because again, another thing that I think is misconstrued is that bariatric surgery is cosmetic surgery. It's just to look good. It's just the mommy makeover, tummy tuck, liposuction, things like that. I can't tell you how many times people have said that when I say I'm a bariatric surgeon, and they're like, "Oh, so you do tummy?" It's like, no, that's not what we do. That's not the goal. Is not to just, aesthetically look good. It's really the major goal is to help you with your health, your overall health. And the data has proven that time and time again. People who get bariatric surgery, depending on the type, can, completely reverse their diabetes, where their A1Cs were out of control. They were on insulin and it wasn't helping fix it. They get a gastric bypass or a SATI, and their diabetes is gone. And it's gone. I've seen patients where we do a gastric bypass and they're off their insulin within 1 to 2 days after the surgery, and it has nothing. And that's before they've lost all their weight. So as you can see, that it has nothing to do with just the weight that you're carrying, but there's actually a huge metabolic hormonal component to it that the surgery is fixing and helping reset your homeostasis that you didn't have before. The other effects that we always talk about is, cardiovascular outcomes, how it helps you minimize your heart attack risk, lowers cholesterol, really lowers like high blood pressure, sleep apnea, all these chronic medical conditions that negatively impact your health in the long term. And what, people, the internal medicine doctors and endocrinologists are trying to manage with your medications, your high blood pressure medications, your diabetes medications. When you have sleep apnea, putting on your CPAP machines, certain surgeries that you may need because of that. But by just getting this one surgery, it can help reverse and dampen the morbidity of all of these different conditions that are associated with obesity, which that's the reason that I got into this field. And I think that's the powerful thing about it, and something that people really need to know and understand. One of the big, there was a session called the Big Papers, top papers. And I think one of the best ones was talking about how bariatric surgery, from the health effect, dampening all these morbidities, et cetera, and losing all this weight, literally will give you an extra 10 years on your life. I mean, that's amazing. Like that's very few things that in medicine that, we can say like, oh yeah, we will help increase your lifespan by doing this intervention. I mean, and to increase your lifespan by a decade, like that's an extra 10 years of your life that you can spend with your family and not just spend with your family just being alive, but spend with your family well, like with a better quality of life. I can't tell you how many times, we're in the clinic and patients will tell me, I can bend down and grab my kid now. I can go to the park and play with them. And the look of joy on their faces to be able to give back something that they didn't really even understand or know how big a deal it was until they could do it again because they just had accepted that this was their new baseline, that they weren't going to be able to do this anymore. And just seeing that look of joy on their face, I mean, that's why I do it. I mean, that's what gives you that re-energizing breath of fresh air of like, this is why we're doing this and this is why we need to keep doing this to help people in this country and honestly worldwide too. So um no, it was a great conference, had a great time, learned a lot, met great people, saw some of the new exciting technology coming down the pipeline, saw where the field is heading, and in my opinion is in a positive place as long as you are a person that accepts innovation, that accepts collaboration, that accepts that to be in this space in the future, you're gonna have to adapt and be essentially like a new like this, adapt and replicate and mimic what the oncologists do. And if you can do that and pivot that way, I think that you're going to be very successful. So, yeah, I mean, those are the big things. I will update you guys on where I end up going. Again, as I mentioned before, I've got some episodes on the back burner. So definitely we'll be releasing those on a weekly basis and then recording some new episodes based on the feedback that I've gotten so far. And so hopefully that'll be coming down the pipeline pretty soon. The other thing is that hopefully we'll get a website up and running. I am not a tech person at all. And this is all in, recording this podcast, everything, this is all new to me. So please give me some time, some patience, but I will have something up soon that I can share every resource that I can possible with everyone because I think information and knowledge is power and it shouldn't be siloed. It shouldn't be gatekept, by us in the medical community, by anyone. And at the end of the day, people need to have access to that information so that they can make the informed decisions as best to their ability as possible and really, try to abolish all this disingenuous information, false information that's so easily spread and goes around, and it really negatively impacts the health of the American people and just people in general. And we really, as a bariatric surgery community, I think need to do a better job of educating people, which is really that's really the goal of this podcast and why I wanted to do it was that I wanted to educate and answer questions and dispel misinformation and just falsehood in general. So if you have any suggestions, any questions that you would like answered or just want to connect, please email me at my email, drajsahat@gmail.com. Would love to connect with you and look forward to pumping out new episodes and more information to help everyone on their bariatric journey and to just help educate everybody. So I'll be signing off this morning and we'll be seeing you weekly. Have a great day.
Thank you for listening to Barry Chat with Dr. Sahat, where we have real conversations about surgery, healing, and hope. If you found this episode helpful, please take a moment to like, share, and leave a review wherever you listen. It really helps others find the show and join the conversation. If you have questions or topics you'd like me to cover, you can email me directly at drajsahat@gmail.com. And if you'd like to stay connected, follow the links in my link tree, right in the podcast title, for my social media pages, updates, and educational content. I'm Dr. AJ Sahat, and this is Barry Chat, real talk about surgery, healing, and hope. The information in this podcast is for educational purposes only and should not be taken as medical advice. Everyone's health situation is unique, and decisions about bariatric or metabolic surgery should always be made in consultation with your own physician or healthcare team.